Louisiana has the highest maternal mortality rate in the country. That means more women die during pregnancy here than anywhere else. And for their families, it often means losing two people, not one.
Eleanor Tabone talked with one man trying to save other women from the tragedy that took his sister and newborn nephew.
You never think that your baby sister gonna leave before you.
For the first time, Eugene Collins is telling his family's story.
I remember the last thing she told me was, "Big brother, I already talked to God and it's gonna be all right." And those words still hit me to this day.
It's a story many families across the state of Louisiana have in common.
That system didn't care enough. And to this day, I believe that if they had cared a little bit more, she would still be here.
Jessica Collins was only 33 when she died.
Jessica was an amazing person. She was nice. She was one of the sweetest girls you ever wanted to meet.
I'm about to pray for you just as hard as I pray for myself, and continue to love and care for you until the end of time. All right?
I promise to be your navigator, sympathizer, sidekick, best friend, and more for your husband.
The young woman had just tied the knot with the love of her life and started a catering business.
She was an amazing cook. Every one of my birthdays, she would always fix me a cake, and she would always put my fraternity letters on the cake and stuff like that. During the holidays, she was always the person cooking.
Jessica was a working mother, raising her 10-year-old daughter, Alana.
Who is an amazing young lady, right? She just finished the 8th grade. She's going to high school, where she continues to excel.
March 2nd, 2020, Jessica was pregnant with her second baby, Jace Ruffin. Eugene says she was having some troubles, so she went to the ER. She
went to the emergency room, and the emergency room actually sent her back home. My mom told her to go back, so she went back to the hospital, and they set her in the emergency room. And it's unclear on how long she sat there, but she sat in the emergency room. This is the beginning of COVID, and she sat there in the emergency room and had a stroke. Witnesses from the emergency room that day tells us that somebody drug her across the floor. She was a bigger woman, and they had some trouble picking her up from what the witness told me, and they drug her across the floor.
Jessica was then admitted to hospital.
That's when I found out that the baby probably wouldn't make it, and Jessica was in some real danger.
She was transported to New Orleans after prematurely delivering her son, who remained at a hospital in Baton Rouge.
My mom, who had had some medical training and worked for a doctor for a number of years, just kept saying that they're not doing something right. They're giving her too much medicine. They're giving her too much medicine.
On March 15th, Jessica passed away. Her newborn died a few days before her. They died in different hospitals in different cities.
My sister was at a Mardi Gras parade 2 weeks before, right? So my sister was living life. She was vibrant. Like, we didn't know anything was wrong.
The Louisiana Health Department reports 4 black mothers die for every 1 white mother, and every 2 black babies die for every 1 white baby.
Black women, based on that, on our data, are at the greatest risk. We also see a disparity in terms of education, and so the majority of our deaths are among women that have a high school diploma or less.
Dr. Veronica Gillespie-Bell, an OBGYN and Ochsner's Health and Medical Director, says majority of deaths occur between the time of delivery up to 1 year postpartum, and that between 2017 and 2019, there were 182 confirmed pregnancy-associated deaths across the state.
We have some unique challenges in Louisiana, one being our maternity deserts. There's 0 OBGYNs or no birthing hospitals per 10,000 live births.
I'm talking concerning my daughter and my grandson, which passed last year in March. Her name was Jessica DeJuan Collins Ruffin. His name was Jace Lawrence Michael Ruffin. Somebody didn't care. It has to be fixed. Because I don't want to know that some other family went through what I went through.
The Collins family, along with pregnancy advocates, are fighting for change, pushing lawmakers to do something so more mothers don't die.
It is so important for moms to have continuous coverage. Giving birth does not end in that birthing room.
Frankie Robertson, founder of the Amalda Group, an organisation addressing social and political determinants of health that impact black women, says the state needs to eliminate all maternity care deserts.
Having access to midwifery care, allowing for midwifery care or midwives to be a part of the team, making sure that they're covered in insurance, that Medicaid is covering this care, that reimbursement rates rather are high enough so that midwives will and can accept Medicaid and run productive practices.
There's no reason that black and brown women should walk at the hospital the same way, but less of them walk out.
I'm sorry for your loss.
Oh, yeah. It's been a rough one.
Her big brother says he still holds regret in his heart for not being able to do more for Jessica.
Her not being here, you know, it's just like, it's hard as a big brother. I'm very protective one, right? You know, it's tough. It's tough.
Yeah, you couldn't protect her.
Yeah, I couldn't protect her. Couldn't save her from this.
Eleanor Tabone, Eyewitness News.
The Louisiana Pregnancy Associated Mortality Review report looked at pregnancy-related deaths from 2017 to 2019. It found 80% of them were considered potentially preventable.